Hi Jen, I've chosen to do my pamphlet on lumbar puncture and cerebral spinal fluid examination. Lumbar puncture. Lumbar puncture, often referred to as a spinal tap, is a procedure that involves inserting a long, thin spinal needle into the lumbar area of your spinal canal, mainly to extract a sample of cerebral spinal fluid for cerebral spinal fluid examination. Other purposes of a lumbar puncture include measurement of the pressure of the fluid surrounding the brain and spinal cord, injection of spinal anesthetics, chemotherapy drugs, or other medications, injection of dye or radioactive substances into CSF to make diagnostic images of fluids flow. How is lumbar puncture performed? Lumbar puncture is performed by a trained physician or nurse, either in the doctor's office, a hospital, or in a radiology department, if fluoroscopy is used. You will be asked to empty your bladder and bowels and put on a gown before the procedure begins. Lumbar puncture is most commonly performed lying on your side on a bed with your knees brought to your chest, or sitting on the edge of a bed or a chair, leaning forward over the table with your head and chest bent toward your knees. If fluoroscopy is required, you will be lying on your stomach. When you are in position, your back will be cleaned with a sterile solution, and the doctor may also mark the area with a pen where the puncture will occur. A numbing cream or local anesthetic or spray is applied to your skin, and an anesthetic is then injected to numb the area. Once the area is numb, the doctor will insert a long, thin spinal needle between the two vertebrae, usually between L3 and L4, and into the spinal canal. X-ray is sometimes used to position the needle. When the needle is in the correct position, a small amount of spinal fluid will drip from the needle. A small device called a manometer is hooked to the needle to measure the pressure of the cerebral spinal fluid. Several small samples of cerebral spinal fluid are collected, and closing pressure reading may be taken. The needle is retracted, and the puncture site is cleaned and a bandage is applied. After a lumbar puncture, your cerebral spinal fluid will be sent for examination. So how long does the procedure take? The procedure will take approximately 30 minutes, but you will be asked to lie down flat for approximately 1 to 4 hours afterward to reduce the chance of headaches. So what are the risks? Before a lumbar puncture, you will be required to sign a release form indicating that you are aware of the risks of this procedure, and although the lumbar puncture is generally safe, the following risks should be considered. Bleeding from the puncture site into the spinal fluid, discomfort during and after the procedure, infection at the puncture site. 10 to 25% of patients develop a headache after the procedure. CSF leak may occur. About 1 out of 1,000 people develop minor nerve damage, which heals on its own. Very rarely will serious nerve damage occur. Damage to the cartilage between the vertebrae. Cerebrospinal fluid examination. Cerebrospinal fluid examination is a series of laboratory tests that analyzes a sample of your CSF. Examination of your CSF can help us detect the cause and symptoms related to disorders, diseases, infection, and trauma of the central nervous system, which is comprised of the brain and spinal cord. CSF is studied for color, blood cell counts, protein, glucose, and other substances. Disorders and diseases detected by CSF analysis. Viruses, bacteria, fungi, and parasites such as meningitis, encephalitis, tuberculosis, fungal infections, West Nile virus, and Eastern equine encephalitis virus. Hemorrhaging and intracranial bleeding. Immune system disorders that affect the central nervous system. Guillain-Barré syndrome, sarcoidosis, neurosyphilis, and multiple sclerosis. Also, to detect primary tumors of the brain or spine and metastatic cancers that have spread to the central nervous system. Following up after a CSF analysis, healthy CSF should appear clear when extracted. Normal results mean that nothing abnormal was found in the spinal fluid. All measured levels of CSF components were found to be within a normal range. Your follow-up will depend on what caused your cerebrospinal fluid test to be abnormal. You may require further tests to get confirmed diagnosis. Treatment will vary with outcomes. And things to consider before a lumbar puncture. Before lumbar puncture, it is important that you tell your doctor if you are taking any medications and if you should take them on the day of the exam. If you may be allergic to any medicines, particularly anesthetics. If you are having bleeding problems or take blood thinners such as aspirin, clopidogrel, Plavix or warfarin, or Coumadin. Even over-the-counter medicines like ibuprofen, Advil, Motrin, or Noxapron, or Aleve. If you might be pregnant, if you are taking any natural health supplements, because some cause blood thinning, and if you have any concerns about the procedure or the risks involved. And that is my brochure.